I'm Matt Goodemote from Goodemote Physical Therapy and PhysioFit Physical Therapy. I wanted to provide a brief video on things you can do if you are stuck sitting at a computer for extra long periods of time. I recently filled out the payroll protection plan application, and I talked to a few bankers and CPAs, and they are working their tookuses off to try to get small businesses like mine help from the government. So I just want to say thank you, because it was a nightmare for me. I can't even imagine what it's like for you guys. So if you're sitting, first things first, when sitting, scoot your butt all the way back in the chair. So even at your desk, when you try to sit forward, research shows that after 5 minutes, you're slouching. And slouchy, slouchy, slouchy equals ouchie, ouchie, ouchie. So what you want to do is you want to use the backrest. So scoot your butt back and physically sit back. If you're at an office, look in the conference rooms or your reception area for chairs more similar to this, because ideally the chair will hit you about middle of your back. For a woman, right around where the bra strap is. What you can do if your chair back is higher is put some cushions like a blanket or towel to boost you up. And you want to do that for the exercise. If you're doing work, just sit in the chair normally. For exercise though, the first exercise is called a retraction. So what you do is you simply lean back, but keep your eyes forward. At the office, we call this the don't kiss me exercise. So if someone's trying to give you a kiss, you back up away and you keep your eyes on them so you can see them. What this is doing is taking your sternum and it's lifting it to the sky. That makes your thoracic spine go backwards in what's called extension, and that allows your head to come back as well. When we're sitting forward slouched, all the weight of our head is coming forward, making more tension in our upper back and neck, and it puts a strain on the joints. So by doing the retractions, you're taking that tension away and making it feel better. One of the most common mistakes people make is when they have tightness to one side, specifically tightness turning to the right when it hurts on the right, is they try to do stretches thinking that it's muscular. It is not, it's your joint. Anytime you have an obstruction or difficulty turning, that means the joint is the source of the problem, not muscle. Stretching won't help, and if it does, it'll take you weeks. So what to do is that simple retraction motion, or you can side bend to the painful side. Just a little bit of side bend shortens the muscles, and that allows the muscles to relax. Every 30 to 45 minutes, you should stand up, interlace your fingers, flip them so the palms are to the ground, reach to the sky, look up at your hands, bring your hands down to your side, bring your chin towards your throat, and ease off a little bit. This is a posture reset. From the side, it looks like this. I interlace my fingers, flip them, reach to the sky, look up at my hands, bring my hands down to the side, bring my chin towards my throat, ease off a little bit. Again, it's lifting that thoracic spine, brings the head back, takes the tension off the upper back and neck. If your lower back is bothering you, my favorite exercise is feet about shoulder width apart and a simple backwards bend. These are not meant to be held as stretches. They are range of motion or movements to take tension off. So when you're doing that backwards bend, it's a lean back, pause, and then come forward. Maybe 1,001, 1,002 count. Each time you go, try to go as far as you can. So for those of you who are having some lower back or neck pain from too much sitting, my recommendation is move more often, 30 to 45 minutes maximum, then change your position. Do the chair exercises when you're able. When you get up to go to the restroom, make sure you do your overhead stretches and your backwards bend. If you do that every time you go to the restroom, you'll be doing it 5 times a day minimum. And if you do it throughout the day, you'll have a lot less back and neck pain. If you have any questions, you can call there. 518-306-1225, physiofitpt@gmail.com or physiofitpt. You can also reach me at Goodemote PT. Goodemote is my last name, and we're in the website and internet and all over the place. So any questions, give me a call. Good luck, and thank you for all the work you're doing.